Good morning, everybody. Welcome to our final town hall for the fall semester. I hope that everyone had a healthy and happy Thanksgiving, albeit the fact that it was not what we would typically expect. We look forward to spending an hour with you to be able to answer any questions that you might have about the university and our plans for spring. I also want to take a moment at this time to acknowledge the passing of a great Marylander. That would be Senator Paul Sarbanes, who passed away yesterday. He was a champion for so many causes that are important to the state, including the Chesapeake Bay, and of course was instrumental in the Oxley-Sarbanes Act of Reform earlier in the 2000s. So I just want to acknowledge the fact that he was a great leader and a great advancer of issues related to the public good. And if we could just have a moment of silence for Senator Sarbanes.
It appears President Schatzel may have dropped off the call for connectivity. We'll see if we can get her back online here momentarily. She had some initial remarks that she wanted to share with everybody gathered here this morning, but we'll pick things up here and get everybody introduced to the panel in the meantime as we try to get President Schatzel back on the call. I want to introduce myself. I'm Sean Welsh. I'm the Interim Vice President for University Marketing and Communications, and I will be your host and moderator for this morning's faculty and staff town hall. To submit questions for this town hall, please utilize the Q&A function on your screen. I see we already have some coming in here this morning. We will moderate questions on this town hall to answer those most pertinent to our faculty and staff joining us here this morning. If you want to ask a question after the town hall, we will not be able to ask those during the town hall, but if there are some that come up after, you are welcome to email asktu@towson.edu. A recording of this town hall will be made available on the university website later this week with captions. And I'd also like to welcome our coordinator of interpretive services, Barbara Menges, who will serve as our ASL interpreter for this morning's town hall. And I will hand it back over to President Schatzel now to finish her opening remarks.
I apologize the fact that I had a technical difficulty in my office, and I apologize also for the timing of it. Again, we want to acknowledge the leadership and all that was done for Maryland by Senator Sarbanes. And again, I look forward to the fact that we're going to spend this time with each other to be able to learn more about what's occurred this semester. And really, we want to spend most of the time answering your questions about this semester as well as the spring semester going forward. So with that, I'll turn it back over to Sean so we can get as many questions answered as possible.
All right, thank you. Again, as I mentioned, we have some questions coming in already. I believe most of you know the rest of the panel here this morning, so I will hold off on introductions for everyone. One of the first ones that came in here, in the news recently, we had about 2/3 of Towson University's eligible graduates from the Department of Nursing graduated early to head to the front line to help combat the COVID-19 pandemic. And a question that has come in this morning is, can you speak about the early graduation and how that was facilitated? And I'll hand that over to Provost Perot to take a crack at first.
Hi, thanks, Sean. So I think that the question said 2/3 of the nursing students graduated, but that's incorrect. It's 2/3 of those who were planning to graduate in December are able to graduate early, and then the other third still have some remaining requirements to do that wouldn't allow them to be able to graduate early. And so when we're talking graduating early, we're talking a couple of weeks. And so, we're really pleased that the faculty in the nursing program, the dean, and the students all anticipated, of course, that this might happen and that the earlier we could get folks out there and serving the state of Maryland and other nearby states, the better. And so they simply moved everything up. doubled down in some cases on some of the clinicals and hit all of the required academic requirements early. And we're just really happy to be able to support that and thank our students so much for their willingness to go out and serve.
Thank you. A very broad question here, as well as one of the first ones. How is the university doing financially? And I believe that one could go to either VP Lowenthal or to President Schatzel, but we'll give Vice President Lowenthal the first crack at that question here. How the university is doing financially at this point in time in the midst of the pandemic.
Thank you, Sean. So as we've described many times, the financial pressures are obviously great. We have lost approximately $75 million in revenue over the current fiscal year. However, the many other compensating factors that we put into place, including some reductions in the departments, cutbacks in terms of what we're purchasing, the hiring freeze, the travel freeze, and I wanted to acknowledge really everybody that's on the call and the entire university community and their cooperation in all of this. It's been fantastic, which has enabled us to close that gap in a very big way. In addition to the fact that we had some federal CARES money that we carried forward from fiscal year 20 to 21, and all of that put together has us remaining in relatively good financial condition. We would say that all of this has been accomplished, and therefore we're still in a place that we've said all along where we don't anticipate any layoffs and any furloughs. So the sacrifice that you are all making is very much appreciated and has translated into our ability to avoid having to do any layoffs and furloughs. And we very much appreciate and understand that it's not a simple or easy situation. And as we move forward into fiscal year 22, obviously there are a lot of question marks. We don't conjecture or make predictions at this point, but we should know a lot more in the next month or so as we hear results of the state's revenue collections for the second quarter, and we start getting some insight as to what the governor's budget will look like for fiscal year 22, at which point we'll have a lot more information going forward. I don't know if the president wants to add anything to that.
Yeah, I just want to echo what Bennett said. The pandemic has taken a heavy financial toll on the university, as everybody reads. It's happening for universities across the nation. I very, very much appreciate all the support that everybody's given to the actions that we've taken in order to make personnel actions absolute last resort. And we've been successful in not having to go there, and we will continue to make them a last resort. It's really causing everybody to do more with less. I understand that, and I think all of us that are on the call understand that. We also know that people are pivoting to be able to do jobs that they didn't do before because of the fact that we've had some reassignment of duties associated with it. So I just want to say that I greatly appreciate everybody coming together as a campus community to be able to support these actions. I can't tell you when we're going to be over, and I know that question is there. When will we be looking for a loosening of the hiring freeze? When are we going to be looking at what we're going to know in the future? I can tell you the fact we'll know a lot more probably later this month in December, if not by the beginning of session in January, but that won't play out until the end of April. We had about a $13 million cut from the state in terms of our budget. That might become permanent. We have to take a look at that. Also, with fiscal 22, we don't know what further cuts might be anticipated from the state. All of that's going to come into play over the next several weeks when the state becomes more knowledgeable about what the revenue forecasts are for fiscal 22. So we'll keep you informed. We're cautiously optimistic. I want to be able to say that. I've talked to several legislators over the last, let's say 6 weeks, including the Speaker of the House, including Senator Ferguson, members of the Budget Committee, and they're all cautiously optimistic. in terms of the fact that the numbers that were given earlier this year in the third quarter were much less than was anticipated in terms of state revenue shortfalls. But again, we need to see what the numbers are. And I just want to end this by saying I greatly appreciate everybody's support and rallying around each other. And we'll keep you informed. As soon as we know more about what we're looking at for fiscal 22, we'll make sure that we communicate that as quickly as possible.
Thank you. A follow-up to that one, and this could go to VP Lowenthal or AVP Jones. Is a COLA still scheduled for January 1 of 21? Is that something that is still in discussion? If there's any clarity we can give around a cost of living increase for faculty and staff.
So I can take that. If Steve wants to add after I respond, you're welcome to do so. At this point, the COLA is technically in the budget for January 1, 2021, as the questioner posed. I would say, again, hard to conjecture. However, on this one, every indication that we've had to date is that it is very likely not to go forward. And that's based on some of the same discussions that the president was mentioning moments ago and that I've had with my colleagues, both at the system level at other campuses. So I would say, although it's in the budget, more than likely, it will be something that, due to the financial pressures at the state level, will be, I would say, at least deferred at this point in time, is my understanding.
Thank you. We have a very broad question in regards to our plans for the spring. So I'll break this one down if I can and ask it in a couple different ways to address a number of the questions that have come through. With the rise in COVID cases, again, could you please reiterate what the plans are for the spring? One of the first things that was asked was classes, and we also have some questions around the in-person teaching element for faculty. So we'll ask that first to Provost Perot, what our plans are in general for classes in the spring term.
Sure. So we've already scheduled the spring semester, and faculty again had the choice on how they wanted to deliver the courses, online, hybrid, or face-to-face. That remains true. It's our expectation is that we will be able to have some hybrid courses, all of the de-densified classrooms, of course. Clinicals, some performance courses. So really the same profile that we intended to have for fall 20, we would hope to be able to have in the spring of 2021. Again, you have to watch what happens with the virus and be prepared. But we've made some changes, and we feel like we're prepared to adapt and as necessary with health and safety first and foremost. But so that is my expectation. We'll have a mixture of online, hybrid, some face-to-face through the spring semester.
Thank you. And I'll pose the next one to Vice President Hurt. This one is in regards to housing, events, specifically TU and student-oriented events on campus, but also non-university events, some of those events where we bring in others from outside of the university to our campus. What plans do we have in place for housing and events on campus for the spring term?
Sure. So I'll start with housing. As we plan for the fall, we'll continue to have even further de-densified housing model. So we'll have one student per bedroom, no more than two students sharing a bathroom. And so that will have us with about capacity of about 2,300 students and residents. One of the other significant changes we've made in our housing model is we have more than doubled dedicated space for quarantine and isolation, and actually will have additional space to be able to utilize if we have surge needs. So that's a significant change to our housing model. In terms of events on campus, as we did with the fall, we won't be hosting any externally sponsored events for the spring semester. However, depending upon how the numbers look both on campus as well as with the broader county and state context looks like in terms of managing the virus, do want to be able to have some face-to-face programming in addition to our virtual programming, specifically targeted for our student organizations and as well as some of our departments on campus. They'll be pretty minimal as we want to continue to be in line with the local and the state guidance as well as CDC guidance. But we are hopeful that we'll be able to have some limited face-to-face activities in addition to our virtual activities.
Thank you. Another question, kind of coming off of that same branch of questions in regards to the spring. What are our plans around dining for the spring? And I'll ask that to VP Lowenthal, if you could provide us a glimpse at what dining might look like for the spring term on campus.
Thank you, Sean. So dining on campus will be in place. All plans as previously posted will be available. They remain at the previous fiscal year pricing. So there was no increase to any of those plans. And for those who are on campus, we will ensure that the appropriate facilities are open for everyone to be able to get either dine-in or takeout options. Some of the construction on campus currently, though, of course, has had such that some of our facilities will be closed. So Susquehanna will continue to be closed. However, we do have the new Glen Dining, which is a beautiful facility recently remodeled that will be open, as well as the West Village Commons will be open, and a number of other facilities around campus, including a new location in our new science complex. So we'll be sure that we have enough locations open to address the needs of all of the students on campus.
Thank you. There's some questions coming in with some ask for some specificity and clarity around who is eligible to be tested at the University Health Center at this point in time, and also whether or not testing will be required when we return from after the winter break for individuals returning to campus. So Dr. Hurd, if you could provide some details, some update around who is eligible to be tested at the University Health Center now, and then for either you or perhaps Provost Perot, some details around who or if anyone will be tested when we come back from winter break in January.
Sure. So the university early in the semester moved to a sentinel testing model, which allows us to take an ongoing kind of snapshot. So every 2 weeks, kind of a snapshot of testing for our campus. So that includes members of the residential student community, as well as commuter students and faculty and staff who are regularly coming to campus. So it allows us to take a random sample of those individuals on a regular basis. So we're testing about 500 individuals every 2 weeks. In addition to that, in compliance with NCAA regulations, our student athletes continue to be tested based on NCAA requirements. So in addition to our sentinel testing, we also have testing available for our students who are symptomatic. And so for students who are regularly attending or going to the health center for various different health needs, if they are required by the health staff at the health center or their own physician, then they are able to be tested. In addition to that, we continue to provide information for the various different free testing sites that are available across the state.
And I'll jump in, and the spring testing plan does call for everybody to be retested. So the plan as it stands right now, and again, just always have to add the caution. We'll follow the best science of the day. It's a rapidly evolving field, of course, but the plan as it stands right now is to retest everybody who plans to come back to campus in the spring. So all faculty, staff, and students so commuters and residential, will require to have a negative test before coming to campus. So whether that's on our campus itself or somewhere else at another facility, you have to have one within, right now it's 14 days and it may move to 10 days of coming to campus. So stay tuned as we get closer, but that is the plan as it stands, to retest everybody.
And Sean, if I can just add the fact that we've talked about changes in terms of policy and protocols. One of the things that we do is, of course, we coordinate with the University System of Maryland, as well as local health authorities, as well as state. But one of the changes that we've made between the semesters is we've actually formalized a TU Medical Advisory Committee. That's a standing oversight committee that provides counsel to us in terms of policies associated with it. And I think that's important to be able to point out. It's a 6-person committee, and I can share who's on it. Kate Tracy is a professor of epidemiology and public health at the University of Maryland School of Medicine. Lisa Carey is a physician with GBMC. Luka Kovacs is our TU sports physician. He actually comes from MedStar Health and provides that oversight. George Elder is the supervisor of disease control with the Baltimore County Public Health Department. Lisa Murray, who is our TU University Health Center supervisor of clinical services. We have Bruce Griffin, who is the chief risk and compliance officer. Anthony Savakis, who of course is the associate vice president in charge of the University Health. And then Haley Mark, who is the head of the department chair for School of Nursing. And these individuals meet weekly. They confer with both county, state, local, as well as USM, and we do as well. So the types of changes that we might be considering, as well as the types of protocols we've already put in place with regard to testing, with regard to quarantine, with regard to dining options, et cetera. These have been reviewed by this committee, and they've provided advice and counsel to us, and will continue to do so.
Thank you. Next step off of the questions surrounding testing, we've had a number of questions come in around the access to the vaccine for the COVID-19 virus. The questions that have come in are a couple different folds here, where we're looking at the access to it and the requirement to have it. So the first question I think we should ask, and obviously this is another one of those that will fall into that category of rapidly evolving and very likely to change over the course of the next couple of weeks as we head into the spring. But what are the university's plans at this point in time as it pertains to access to the vaccine for individuals on the campus? Or are we going to be a vaccination site? So I will pass that one either to President Schatzel, if you wish, or to Dr. Hurt to begin answering.
So why don't I give it broadly, and then I'll ask Vernon to kind of step in on that. So as everybody knows, this is very, very rapidly evolving, both within Maryland as well as nationwide. The distribution will, as of now, will be determined at the state level. And the state of Maryland is basically looking at first responders as well as nursing home residents and staff to be able to be those that receive the vaccine first. Right now at the state level, they're determining what's going to be the quantity of vaccines that will be provided, but those will be the first individuals that will receive it, and the production of the vaccine will be produced at that time. We are qualified, and we are working with Baltimore County to be a vaccine distribution site if needed. We haven't been turned on yet for it, but part of that is the plans are evolving at this time. But we are positioned to be able to do it. The other question, of course, is the fact that there's certain types of requirements that we'd have to learn about, both in terms of storage, distribution, IT requirements. And that's kind of what we're researching right now, is to be able to position ourselves that if asked, that we could be a vaccination site for the county and for the state. And again, who gets it, that's a rapidly evolving circumstance that's being informed at the state level and at the local county level at this time. Probably the second part of this question, and I'll kind of anticipate it, is, are we going to require people to be able to have the vaccine when it becomes available, either in the spring semester or in the fall semester? One of the things that we have, of course, is required vaccines for students on the campus. That much of that is set up in terms of statute by law, for example, meningitis. And again, that's something that we're having conversations at the system level to be able to better understand what would be a uniform approach to the vaccine for the campuses themselves in terms of requirements of any individuals at all. So this will keep you informed, but that's a rapidly evolving area as well. Dr. Hurt, would you like to add some more to that?
No, I think you hit all the high points. I'll just kind of reiterate that A lot of discussion will happen at the system level. And so we'll continue to ensure that as those decisions and clarity is available, that we will be very intentional in making sure the communication is clear and quick to campus.
Thank you both. I'm going to pivot briefly back to testing real fast, as this is a follow-up question in regards to the spring. Or will the required testing to return to campus and buildings apply to those sites off of the main university campus, such as Tune in Northeastern Maryland? I'll ask that to Provost Perot and Dr. Hurd, if you'd like to weigh in on that as well.
The answer to that is yes. And we do have a new system that's being put into place to also make it a little bit easier for folks who are at far-flung locations who might not be able to get back to campus to take the test. It's called CRISP. I don't know what that stands for, the acronym, but it's a larger system that will capture if you've taken the test somewhere else remotely. We'll be able to see that, and if you sign a waiver, we're strongly encouraging everybody to do so. And so people who may live out in Hagerstown and not want to come all the way to campus could take a local test, and it will enter into that system, and we'll be able to check. But that was a long answer to a short question. Which is yes, everybody at the remote sites will also have to be required to take a test.
Thank you. We'll stick with you with this next question as well, Provost Perot. What does the enrollment data look like for the spring semester for 2021? Is it comparable to last spring? If you could give us a little bit of an insight into students returning for the spring term.
We know it'll there's no question it won't be the same as last spring, just based on the fact that the fall came in at 3.5% under, but that was a really good number. It beat expectations. Many schools would be incredibly thrilled to have that sort of small drop in enrollment. We'll know better at the end of this week about spring enrollment, and so it is maybe lagging a little bit from where we would want it to be. We have some work to do in that area, and we're certainly going to push hard to get the best enrollment that we can. We know that students who take a semester off, even one semester off from college, and intend to come back, really don't come back in the numbers that you would like to see. And so it's really in everybody's interest that students continue their progress towards completing their degree. We're here to do that. We've put in all sorts of academic supports. And I know for sure this has been a challenging semester for students and faculty and staff alike. But we know that we're still delivering a high quality academic program. We're highly hopeful again that we'll have some hybrid, some face-to-face. And our faculty have demonstrated incredible ingenuity and dedication in creating courses online that are still really of the highest caliber. So we really want to push that, get students in the classrooms, and we're hopeful that will happen in the spring.
Thank you. We have a question in regards to faculty staff returning in the spring, and I'll ask this one to you, AVP Jones. What can we expect for spring work attendance and requirements? Should we continue to take direction from our immediate supervisor?
Great question, Sean, because obviously with the change in terms of bringing more people back to campus, we're going to have more programs to support on campus and obviously need more face-to-face on the campus. And we've been going through a process over the last several weeks working with managers and supervisors to identify the positions and the people that may need to come to campus to help support the spring semester. Individuals who are coming to campus now should anticipate coming to campus again in the spring. Obviously, they need to talk to their manager and supervisor to get the direction on what their schedule will look like. Individuals who may currently be teleworking that may need, in fact, to come to campus will be notified prior to the winter break of a need for them to return to campus in January for the spring break to support student programs and processes that are going to be on campus campus. And as we've always said, we want to encourage and support telework wherever possible, but we also recognize that there are going to be some positions and some people that we're going to need to have on campus to provide face-to-face or to provide support for students and for programs and processes that we make available during the semester. So the managers and supervisors will be helping us with that and helping make those decisions, and individual staff members, faculty members need to communicate with their managers and supervisors for specifics.
Thank you. This is a question I'll pose to you, President Schatzel. Could you give us an update on construction for the university, and specifically, and this could also obviously go to Provost Perot to a degree, the science complex? If you could give us some details around the science complex and its availability as we head into a new term.
Well, I'll start, but then I'll let the provost talk about the science complex specifically. If for those of you that might have watched the presidential address, you saw that we did a little magic moment where I was in the atrium of the new science complex, and it's absolutely outstanding. I've toured it several times. We have occupancy, and the provost will be talking about the fact that move-in is beginning to be able to have that building prepared for the spring. And we're just thrilled to be able to have that happen. We're also working very, very hard to have the union stay current in terms of this progress to completion. And we're anticipating the fact that that will open in the fall of 21. About 90% of it will be open. There's another 10%, 15% that we anticipated would be a little bit of a phase 2, but we're going to open the vast majority of the building in the fall of 21. And what we've worked very, very hard over the last several years is to be able to position us for about $53 million of investment by the state in the upcoming fiscal 22 budget for the beginning of the construction of the College of Health Professions building, which is going to be located on the north side of campus. And we're very, very excited about that. I've met with, as I said, via Zoom, all the leaders of the Senate as well as the House of Delegates to talk to them about the College of Health Professions building. I've received very, very positive feedback from all of them. I always start my conversation with them in the fact that I feel like a very fortunate president asking for and advocating for a College of Health Professions during a pandemic, and reminding them the fact that we are the largest provider of healthcare professionals in the state. There's a shortage already, and it's anticipated the fact that the pandemic could increase that shortage because of folks retiring, just the toll that it's taking on our healthcare professionals. So we're cautiously optimistic, but we received very good feedback over the fact that we will receive the funding for that, and the construction would begin in the summer of 21, and we're very, very excited about it. It will be fiscal 22 budget, but it will start in the summer of 21. So with that, I'll turn it over to the provost so she can talk about that marvelous science complex that we have opening.
So thank you, President Schatzel. Listen, I've been over at the science complex. It's getting ready to go. They're moving in office furniture at this point, and beakers and things like that. It's absolutely beautiful. It's state-of-the-art facility. Many of the labs are model off what happens over at Hopkins. And so this is really, I mean, it's really a transformative building, and our students and our faculty who get to use the facilities there, it's really just going to help lift up what are already excellent academic programs. And so I can't wait for everyone to get in. I think maybe just stay away for a few more weeks while we're moving, just so you don't get into people's way. But I think January might be a fine time to come over and tour this building. Wear your mask. But it's just really just a gorgeous and useful, well-designed building, and it's something we'll be very proud of. I think every TU faculty and staff and student can be proud of this building, whether your office is in there or not. So please do, in January, come on by and have a look.
Thank you. I'll take a moment now. We're about the halfway point of this to remind everybody to ask questions. Use the Q&A function on your Zoom screen. and that we will have a recorded version of this available on the university website later this week. Some additional questions coming in. When will salaries be restored for those who took pay cuts to assist TU and our fellow faculty, staff, and students? That could go, I guess, to President Schatzel.
Sure, I'll take that. As you know, as part of the cost reduction, cost avoidance program that we put in place with regard to our management of the fiscal challenges that we're facing, 50 of the highest paid individuals within the university, those making over $150,000 a year, took pay cuts anywhere from 2% to 10%. I am very, very grateful, and many of them are all of them are on the call right now, as well as many that are listening. I'm very, very grateful to those leaders to be able to step up and to be able to make that type of sacrifice. I think it's important for the leadership of the university and these leaders to be able to make that type of very, very visible commitment to the fiscal outcome and the fiscal solvency of the university. And it's been recognized by the system leaders, the regents, as well as the legislators. Every single legislative call that I've had with legislative leaders have asked about it. And I've been able to say that I stand with the leaders on campus for making that sacrifice. I would expect that we're going to have conversations about restoration of that in the upcoming spring, as we know more about the upcoming budget. But I don't anticipate this being a long, drawn-out process. I would expect the fact that we will be having serious conversations about doing that sometime in the spring as we take a look at all the rest of the budget considerations to be able to be addressed with fiscal 22.
Thank you. I'm going to briefly pivot back to testing for just a moment. And this is a question that has come in a couple of times, and we'll remind everybody here that we're going to work through as many of these questions as we can with the focus on faculty and staff. This one has come through a number of times here on the questions this morning. And if there are any questions that don't pertain to faculty and staff, and specifically from the student and family community, the asktu@towson.edu email address is open, and we'll answer any of those questions that we possibly can after this town hall as well. Specifically though, back to testing, there's been a question that has come in a couple of times in regards to our capacity at the health center right now for testing, and how students can qualify to have tests done on the University Health Center test site, and also what options there are for students to get testing done. So I'll ask that to Dr. Hurd, if you could provide some additional clarity for how students can have a test performed at the University Health Center.
Sure. So any students who have a medical need to be tested can be tested at the University Health Center. One of the things that actually triggers that is completion of the daily quick scan. And so for students, for example, who report any symptoms through the quick scan, through that follow-up process, we'll have the opportunity to actually schedule to be tested at the health center. But if you are visiting the health center for a normal medical checkup and the medical staff determines it's appropriate to be tested, you'll be tested. If you have a referral from your own personal physician to be tested, you can be tested at the health center. They would just need to provide the documentation to the health center staff. And so any students who have the medical need to be tested can be tested at the health center.
Thank you. We also have a question that just came in about statistics being reported on the university website of individuals on campus. Our testing and data from that testing is made available at the university website, and we'll make sure we get that information provided back out in the latest faculty staff resource email, so everybody has access to our dashboard, which is updated weekly by Thursday morning. Question in about spring classes and the modality of spring classes. So I'll pass this to you, Provost Perot. Will students still have the ability to choose the modality of their classes, even if it's being offered in person? For example, if a student is out of state and opts to stay home and away from campus in the spring, will they still have the option to have those classes provided to them in a remote modality?
So it's a great question, and the answer is that they will in almost all cases. There's a few exceptions, of course, a clinical rotation, maybe some internships that can't be completed in wherever you are, and some performance classes, but those are very small numbers. Other than that, again, even if the course is scheduled to be face-to-face, we've outfitted all of the rooms to be able to record courses or broadcast simultaneously. So students will continue to have that choice.
I have a question in as well about other offerings from the University Health Center and over at Warden West. What type of mental health support services are we providing for university students, faculty, staff, anybody in our university community? I'll pass this one first to Dr. Hurt, but also leave that one open to AVP Jones to answer as well from a staffing standpoint. What type of mental health support services are we providing to individuals within our university community?
Sure. The Counseling Center continues to be available for our students, undergraduate and graduate students. We have also expanded groups, and so there are a number of engagements happening through groups, one of which is the really focused around how do we continue to build community and just kind of maintain our sense of self-care and mental health through the pandemic. And so I would invite members of the community to check out the Counseling Center website. One of the significant changes we made to the model this year is to actually shift to same-day appointments. And so we have the availability of same-day appointments for our students. Again, call the Counseling Center, check out the website for all the information about how to schedule an appointment, as well as the various different virtual groups that are being made available on a weekly basis.
As far as faculty and staff, one of our benefits, we have an employee assistance program that can be accessed via the website, the OHR website, where the benefits are located. It's 24/7 benefit. It's staffed with professionals. Our faculty and staff, regardless of regular or contingent, all are entitled to use the program, and it also extends the benefit to the immediate family members within the individual's household. I would encourage anyone, in addition to mental health, they deal with financial health, they deal with raising kids, they deal with remote teaching. They've got a variety of resources that are available to all of our faculty and staff, and I would encourage you to give them a call and see how they can meet whatever needs you might have. And certainly if we need to help, if there's anything that we can do to support that or help that, please give us a call too.
And I just want to basically echo both what Vernon and Steve said. These are very, very difficult times. We've been under a lot of stress. Everyone has been under a lot of stress, both as employees, as family members, as partners and spouses, as daughters and sons and grandparents and brothers and sisters. This is a very, very trying time for everyone, and it has been since last March. So I would encourage everybody to be able to please reach out. Please reach out to mental health professionals to be able to support you, as well as your loved ones, because all of us are facing this and know people that are struggling. It's something that we've worked very hard at as a campus community to remove the stigma from. And it's something that we need to do, and we need to encourage others to do, is to be able to reach out for professional help when they need it and not wait. So I very much encourage everybody to make use of those resources. If you need more, contacting both Dr. Hurt or Steve Jones to be able to do that is something that we're here for you to be able to do, because as a community we need to support each other and make sure that we do that. Particularly as I like to say, we're in the final leg of this. It's been a really, really rough 9 months, but with the vaccine. And I have to tell you, every time there's something about the vaccine in the paper or on any media, I read it to make sure that I'm reading something that's hopeful, and that it looks like that we're moving forward on it, and that the world will not continue to be like this. So I just want to tell everybody that I very much appreciate what everybody's been doing to support each other. But please take care of yourselves, and please take care of your family members and make use of the resources that we provide.
Thank you all for your answer to that question. One that has come in, and I'll pass this to AVP Jones to answer, around leave, and specifically COVID, FMLA, and other options that faculty staff may have as it pertains to leave time. Is that something that will be utilized in the winter and into the spring?
Great question, Sean. The initial COVID guidelines that the federal government laid out in terms of worker relief, if you would, set aside some leave situations for individuals that met certain criteria, and those expire at the end of December. And the USM has been having some discussion about internally extending that deadline if the federal government does not, for whatever reason. And we'll have more information on that over the next couple of weeks. But we fully anticipate that whether it's the federal government or it's the USM, that there will be an extension of that December 31 date. More than likely, probably internally looking to June. But certainly if the federal government were to come in and extend it further, obviously that would that would supersede whatever we do at the system level. But the intent is to try to continue to provide somewhat of a safety net in terms of emergency family medical leave or leave related to a COVID event, so that we can help protect individuals that run into a situation where they just need some additional leave. And we're certainly going to do whatever we can to make sure that that happens.
Thank you. Question for Provost Perot. If you could give a little bit of information about the January conference for faculty, and if there has been a theme established yet for the January conference.
Great. So there is a theme, and it's not just for faculty this year. We're uniting with our colleagues in student affairs to look at how student affairs and academic affairs can collaborate on improving the student experience, both sort of in the classroom and of course outside of the classroom. We know that the student experience, students don't really know which division you report to, nor do they care. What they care about is a holistic experience on the campus. Obviously they're here for academics, but student affairs and academic affairs working together really supply that holistic experience that we want for our students. And so that's the theme. So we'll be working together. I'm really excited to work with Dr. Hurt and his colleagues over there. We've had a few early meetings on this, but it's going to be just a great conference. I think that it's super timely because of COVID. These are important collaborations at any time, but they couldn't be any more important than they are in the next year. So we'll be doing that. And so I really hope we get lots of faculty and staff to participate.
Thank you. Some questions in regarding athletics for the spring term, and what the plans are surrounding athletics, as well as a question about the testing that we're providing for student athletes. I think it's important for us to make the clarification that the testing we're providing for student athletes is NCAA regulated, and it's a requirement of the NCAA for our student athletes to be able to participate. Dr. Hurt, could you answer that question for us and provide a little bit of an update in regards to athletics heading into the spring, as well as the testing requirements that are in place there as it pertains to our student athletes?
Sure. So at this point, the plans in terms of spring sports continue to be in place. So we intend on participating in our spring sports. I will also note in terms of testing that the testing cost is covered within athletics as well. And so again, athletics is required to remain in compliance with the all NCAA requirements. So we anticipate that in the spring semester, our spring sports will move forward. And again, that'll continue to be in compliance with both NCAA as well as CAA.
Thank you. Question in for Provost Perot, if you could provide just a general assessment of how you feel the virtual fall semester has gone and what we've learned from the fall semester as it pertains to virtual learning and virtual teaching.
Great. Well, that's a big question.
Very broad.
Appreciate that. But look, I think there's many lessons have been learned, and primarily they've been learned at where the expertise lies, right? And that's with the faculty themselves. And I think, clearly there's individual lessons that are being learned in individual improvements. But so let me say what I can say from the 30,000 foot experience as provost. One of the lessons that we've learned is that faculty are incredibly dedicated to student success. And look, we knew that before. We know this is a student-centered faculty and a student-centered university, but it was really only magnified in this environment. This is not easy. It was not easy to move quickly in March. It's not any easier to make the changes that happened in the fall. And then early in the fall, the very first week, when we got a lot of feedback from students saying, listen, we miss the synchronous courses. Can we have synchronous courses? I put a plea out to the faculty to do that, even if you're going to be remote. Can we make the courses synchronous? And the faculty overwhelmingly responded by doing that. And that's not a small feat. That was a big ask. And so I want people to understand that was a big ask. And faculty responded simply because they knew that that's what the students were responding to. And so, I can't tell you how appreciative I am of that, and certainly the students. And so that was a big lesson. But look, there's all kinds of small lessons that are happening here and there. How do we redesign assignments for this environment? I know there's lots of concern about academic integrity. And so Facet has stood up a bunch of workshops on that, how to design assignments that are less likely to elicit some of those activities that we don't like, of course. And so the other lesson that I think that I've seen is that faculty are talking to each other in new ways across divisions about how to teach. And that doesn't happen all that often once you get to a university this size. You might talk to your colleagues in your department, but one of the things I found really fascinating is how faculty are working together across divisions, across universities, nationally, these conversations on how do you teach in a remote environment. It's really been interesting. And again, I'm appreciative that nobody's just satisfied with the status quo. We want continuous improvement. We all do. And you're seeing it happen in these courses, and just really have done an amazing job. And so I couldn't be prouder of what's happening here.
Thank you. Question for President Schatzel. What are your expectations of the legislature and governor for this upcoming session, which will begin here in the coming weeks?
That's a great question. As I said, I've spent a lot of time both talking to the legislature as well as the governor and governor's office and the legislative leaders across the board. That one of the things that they're dealing with, particularly in the legislature, is just how do they handle business because of the fact that there's reduced density requirements there. They can't have people show up for testimony the same way. The votes have to be done within the buildings themselves. So there's been much work by the legislature in terms of having to figure out how they're going to just manage the session itself. And that's taken up a lot of time for them to be able to consider, but I think they've got that sorted out, as well as the fact that Senator Ferguson provided the fact that the president of the Senate, that they're going to limit the number of bills just because of the fact that they can't handle the volume given the constraints of how they're going to have to manage the session this coming spring and maintain a high quality of their engagement and decision making. As I said, when it comes to the budget, I would say that there's cautious optimism, pretty good optimism with regard to the capital budget. And in fact, the folks that I've talked to in the legislature have all said the fact that they're looking at the capital budget very much like the Obama investment in terms of infrastructure coming out of the 2008 Great Recession. So we have a shovel-ready program with the College of Health Professions, as I keep reminding them. So I think that I feel optimistic, cautiously optimistic about the capital. The operating budget will very much be impacted by what we're looking at with state revenues. The new administration is perceived as being much more willing to be able to take a look at a further stimulus package that would favorably impact the states in terms of state support. So we'll know that more as that rolls out. But there is optimism over the fact that a stimulus package will be part of the new administration's plan very early, and that will favorably impact the state. So if we're looking at Maryland, we're looking at the fact that the change in administration at the federal level should be positive just in terms of revenues coming to Maryland. So as I said, it's something that we're very, very closely watching. Much of this is going to be what does it look like in the next few weeks with regard to revenue forecasts of the budget that the governor is going to be basing his budgets on. And that's where we're waiting for. What will happen next is the governor will release his budget, both capital as well as operating. That will be the starting point. So when that happens, we immediately see how Towson is positioned. And then we take a look at it to make sure that we either improve it or at least maintain it through the legislature. So I look very much forward to advocating, continuing advocating on Towson's behalf in the upcoming legislative session.
Thank you. We have some questions in around contact tracing and how contact tracing takes place within the university community, specifically in regards to notifying our staff members of any positive COVID cases that they may have come in contact with. So I'll pass this one. This one could go a couple different directions. I'll go with either Provost Perot or Dr. Hurt, if you could provide some details around the contact tracing, and if AVP Jones would like to weigh in there, certainly go ahead.
Sure. So I'll respond with the contact tracing. So when we are notified of a member of our community who does test positive for COVID-19, we have a team on campus that works in collaboration with the Baltimore County Department of Health that really oversees and facilitates the contact tracing. And so in that process, information is gathered in terms of potential contacts, and those individuals are contacted between our campus leadership as well as the Baltimore County Health Department. And they're provided guidance on appropriate next steps, whether it is quarantine, isolation, other next steps that are appropriate based on the guidance from the health department as well as CDC guidance. And so we're really fortunate that we're able to do this work in collaboration with the local health department.
Thank you. That was good. Appreciate it. Some questions have come in around financial aid, and I'll toss this one in the direction of Provost Perot. One has come in twice, and that is if the university is able to clarify details around the deferral process, what is required to defer or keep financial aid, especially scholarships.
So it's a great question. We know students and their families are struggling financially in many cases. And so what we've done is we're actually increasing the financial aid packages that we're able to offer in many cases. So we're working very hard to look for every dollar that we can dedicate to financial aid and to support our students. So we're increasing financial aid packages where we can. We also, of course, again, still have the Student Emergency Fund that can help in these in some of the one-off payments. So please encourage your students who are struggling to reach out into those areas as well. You know, there has been discussion of deferring for a semester and can we just continue on? And again, I just want to reiterate that the national studies show that a student who takes one semester off is far less likely to graduate from a 4-year degree. It just plummets, and people have good intentions, but life intervenes. And so while we will certainly welcome people back to come in the fall who took a semester or even a year off. We absolutely will do that. We really want our best bet for our students and for their success and for their future success is to keep students making progress towards their degree. And to do that, you want to stay in classes. So really our default position is let us help you find a way to stay in your courses. And so if it's a financial aid issue, let's talk to the financial aid office about it. If it's an academic issue where you're having challenges in your classes, we have tutoring for virtually every class on this campus. If it happens to be a health issue or mental health issue, we have the counseling services and we have the health center. So our support systems for students are extensive. And I've just really encouraged folks to reach out for help. If you don't know which resource to turn to, shoot an email over to the Office of the Provost. We'll get you in touch with the right resources to assist. But again, staying into classes is your best bet to complete that degree.
Thank you for that. We've hit the end of our hour here. Before we close and we provide President Schatzel the opportunity for some closing remarks, I'd like to just remind folks that if you would like to ask a question after the town hall closes, or if you feel like yours was not answered here today, please email asktu@towson.edu. We have a frequently asked questions section of the website that we are continuing to keep updated throughout the pandemic. Any information that we need to update in real time, we will update there, as well as through our faculty and staff resource messages that go out each week. So again, asktu@towson.edu. I'd like to thank everybody for joining today, and we'll hand it over to President Schatzel for some closing remarks.
Thanks, Sean. Again, I want to thank all my colleagues that joined me this morning on this call, and all of you that are listening and have asked questions. I hope it was helpful to be able to provide this update. We'll give another update probably before the spring semester starts, but be aware of the fact that if there's any significant change to planning or news that we receive, we will keep you informed. So please check your email for that. Once again, I just want to say thank you to everybody for supporting each other and for supporting our students. It's so important that we continue to do that. I know these are challenging times, but we've come together and supported each other. And it is very inspiring to me, as I know it is to the senior leadership team. So again, thank you very much for everything you're doing to support each other and to support our students. And please do your best to have a very healthy and happy holiday season. And take some joy with the fact that even though we might not be with our families directly, that we have families that we can reach out to and share these memories and these times with. Again, thank you very much for everything that you're doing, and stay safe and stay well.